Hello, my name is Yvonne. The presentation today will be about ciprofloxacin. I'll be discussing the medication indication, common side effects, patient education, background information about ciprofloxacin, and lastly, the warning and precaution for patients that's on this medication. Medication indication. What is this medication for? Ciprofloxacin belongs to a group of antibiotics named fluoroquinolone, and it can be used to treat bacterial infections that are susceptible to this particular antibiotic. The most common conditions can be treated with ciprofloxacin are skin and soft tissue infections, bone and joint infections, complicated intra-abdominal infections, infectious diarrhea, typhoid fever, uncomplicated cervical and urethral gonorrhea, inhalation anthrax, plague, chronic bacterial paresthesis, lower respiratory tract infections, UTI, and acute sinusitis. Now, what side effects can this medication cause? Common side effects reported by patients taking ciprofloxacin are nausea, vomiting, abdominal pain, heartburn, diarrhea, vaginal itching or discharge, pale skin, and unusual tiredness. What are the most important counseling points to the patient they are on ciprofloxacin? First, let's discuss how should the patient take this medication. Ciprofloxacin can be taken with or without food. Patients should drink plenty of fluid while taking ciprofloxacin and separate antacid and ciprofloxacin by at least 2 hours before or 6 hours after. Do not take dairy products such as milk or yogurt or calcium-fortified juice while taking ciprofloxacin. When should a patient contact his or her physician? If the patient is experiencing pain, swelling, or inflammation of a tendon or weakness or inability to use one of their joints, or the patient has persistent headache with or without blurry vision, symptoms of muscle weakness including respiratory difficulties. The patient should also contact their doctor when they develop watery or bloody stools. Lastly, if the patient has hypersensitivity reactions such as skin rash, hives, or other skin condition, a rapid heartbeat, difficulty swallowing or breathing, the patient should stop the medication immediately and contact their physician. Background information will be discussed in this presentation includes mechanism of action, pharmacokinetic, dosage, contraindications, and drug interactions. Ciprofloxacin inhibits the enzyme topoisomerase II and topoisomerase IV. Topoisomerase II is also known as DNA gyrase. Ciprofloxacin inhibits these enzymes by forming fluoroquinolone gyrase complex or fluoroquinolone topoisomerase IV complex. This results in inhibition of bacterial DNA replication, transcription, repair, and recombination. In turn, it causes bacterial cell death. Moving on to how the body processes this medication. First, during the absorption phase, this medication has 70 to 80% oral bioavailability and 20 to 40% plasma protein binding ability during the distribution phase. Ciprofloxacin is primarily metabolized by CYP1A2 in the liver, and the primary metabolites are oxociprofloxacin and pseudociprofloxacin. Last, ciprofloxacin has an average half-life of 4.7 hours in a 250 mg oral dose and 3.65 hours for a 100 mg IV dose. Common pediatric dose for ciprofloxacin are as followed. For complicated cystitis or pyelonephritis, the patient should be dosed at 10 to 20 milligrams per kilogram every 12 hours for duration of 10 to 21 days. The maximum dose is 750 milligrams per dose. For inhalation anthrax, pediatric dose is at 15 milligrams per kilogram every 12 hours for 60 days. For plague, pediatric patients should be dosed at 15 milligrams per kilogram every 8 to 12 hours for 14 days. For adult dosage, skin and soft tissue infections, complicated intra-abdominal infections, lower respiratory tract infections, patients should be treated at 500 to 750 milligrams every 12 hours for 7 to 14 days. For bone and joint infections, patients should be treated at the same dose but for 4 to 8 weeks. For uncomplicated gonorrhea, patients should be treated with a single dose of 250 milligrams ciprofloxacin. For infectious diarrhea, patients can be treated with ciprofloxacin 500 milligrams every 12 hours for 5 to 7 days. Dose adjustment is required for renal impaired adults. For creatinine clearance of 30 to 50 ml per minute patient, dose should not exceed 250 to 500 milligrams every 12 hours. For patients with creatinine clearance of 5 to 29 ml per minute, dosing should be every 18 hours. Patients who are on dialysis should be dosed every 24 hours after dialysis. Who should avoid taking ciprofloxacin? Ciprofloxacin is contraindicated in persons with a history of hypersensitivity to cipro or any quinolone class medication. Ciprofloxacin should also not be given during pregnancy unless the potential benefit is outweigh the risk for both fetus and the mother. Which drugs can interact with ciprofloxacin? An ASAT can reduce the bioavailability of ciprofloxacin by as much as 90%. Ciprofloxacin can increase the serum concentration of tizanidine and cause hypotension. Hypoglycemia may occur when patient is concurrently taking sulfonylurea and ciprofloxacin. Ciprofloxacin should be used with caution on patient that is on warfarin. It can result in increase in INR and risk for bleeding. Ciprofloxacin may further prolong the QT intervals in patients receiving antiarrhythmic drugs and TCA and MOAIs. What are the warning and precautions to patients that are on ciprofloxacin? First, ciprofloxacin have been associated with an increased risk for tinnitus and tendon rupture in all ages. Peripheral neuropathy have been reported in patients that's receiving ciprofloxacin. Symptoms may occur soon after initiations of ciprofloxacin and may be irreversible in some patients. Ciprofloxacin may increase the risk for CNS effects, including convulsions, increased intracranial pressures, and toxic psychosis. Like many other antibiotics, ciprofloxacin can alter the normal flora of the colon, leading to overgrowth of C. difficile and result in C. difficile-associated diarrhea. Ciprofloxacin have neuromuscular blocking activity and may exacerbate muscle weakness in patients with myasthenia gravis. Lastly, taking ciprofloxacin in the absence of proven or strong susceptible bacterial infections or a prophylactic indication is unlikely to provide benefit to patients and may increase the risk of developing a drug-resistant bacteria. And that concludes today's presentation. Thank you.